Hi everyone, welcome to another presentation for our practitioners from the Philippines. Today we shall be reviewing diagnostic prerequisites in Chinese medicine. We shall understand the theoretical and practical frameworks that are necessary for accurate diagnosis in TCM. A strong theoretical foundation in Chinese medicine, physiology, and pathology is essential for accurate diagnosis. By understanding these models, practitioners can recognize the underlying pathomechanisms behind various symptoms and imbalances, facilitating more effective treatment strategies. A solid theoretical foundation in physiology, in TCM. This will enable us to understand how various bodily systems interact and function together. This is very important for effective diagnosis and treatment. Knowledge of the qi dynamics is vital for understanding how energy flows through the body, impacting organ functions and overall health. And we all know that if there is an issue with the qi flow, we can have health issues. This dynamic aspect is essential to identifying imbalances and disturbances in health. Chinese medicine emphasizes the importance of maintaining balance and harmony. No? A balanced system promotes health. Imbalances can lead to various diseases and disorders. So what we would like everyone to embrace is the ability to actually tell what is already wrong with the patient before the condition shows up. No, that's why we're very excited. Okay, about TCM. Understanding pathological dynamics. Understanding pathomechanisms is crucial for deciphering the reasons behind the signs and symptoms. This knowledge allows practitioners to identify disruptions in qi dynamics that will lead to various clinical presentations. Okay? By applying physiological models, we can now recognize deviations from the body's normal state. This awareness helps in identifying specific symptoms that indicate imbalance, guiding effective treatment strategies. Correlating symptoms with underlying causes is important to diagnose conditions. By understanding the root cause, practitioners can now tailor their approaches to better address the patient's unique situation. So what we mean by this is that every patient, no matter how similar their conditions are, will necessitate a unique approach. No, that's what we mean by tailoring their treatment strategy. Now let's talk about stomach chi rebellion. This occurs when the normal downward flow, we all know that, when the downward flow of the stomach chi is disrupted. So what happens? You will have vomiting. So if we understand the physiological and pathological models, we can identify the causes. And what are these causes? Could be chi stagnation, or it could be external factors like cold and heat. Okay. The concept of the norm is essential in TCM diagnosis. This represents the ideal state of balance and harmony. So this is actually what we want to achieve, balance and harmony. By understanding what constitutes normal physiological conditions, we can now better identify when a patient strays from this state. So I'm actually looking at a practice that will really make our patients aware that this is a lifetime thing. No? In fact, I have two couples who would see me for the past 3 or 4 years already, and they never failed to come twice a month because they told me that they save a lot from hospitalizations because when they started the treatments, um, they noticed that they don't get admitted to hospitals anymore. So let's try to educate ourselves more so that we can have clients who are going to be our lifetime patients. Okay. It's just educating them. But there are a lot of people, especially when their conditions are acute, no? They stop coming when they don't see any problem anymore. That's why I always make them aware of how their tongue looks like, how their pulse should feel like, so that they will come back. So, uh, but before we do that, we should look at our tongue first and feel our pulses. So, common signs that are observed in patients may not accurately reflect optimal health. For instance, a pale tongue with teeth marks may be widespread, yet it deviates from the healthier norm of a pink tongue without marks. So, what would you rather have? Of course, the tongue should be pink, not this kind of tongue, no? Okay. Training to recognize deviation. So training is very, very important. That's why um, not only locally, but we should endeavor to attend trainings internationally. Di ba, Sir Jobel? Let's go somewhere else. Okay.
Yes, Doc.
And in fact, we are motivated by the presence of Dr. Rosa Shang. Okay. She promised to teach us Mandarin, and I'm sure you wouldn't mind shelling out some few dollars for the training, because I ask around, it is not cheap, no, when you do it somewhere else. So let's talk about it.
I am ready. I just waiting for you give me signal. I
We're
will
waiting for the
start.
decision of the board, Ma'am Letty. Okay, so we'll let you know. Okay. In fact, if you notice the attendance is not so good, maybe the others are still extending their holiday holiday break.
Maybe Dr. Hector, you make announcement so that the people will come back. For me, yesterday I didn't usually in the group. The
Okay,
send
sure.
reminder, so I did not receive. I did. It's today. I ask. It's
Okay.
good. You tell.
Yeah, I'll make an announcement the day before, okay? I'm sorry about the, failure to make the announcement. But
Thank you.
anyway, what is important is you're here and it's good to really see you back. Now, trained observation skills will allow practitioners to notice subtle deviations from the norm. Because sometimes the patient may look apparently healthy, but in reality, there is an imbalance. So when we see an imbalance, it doesn't mean that the patient is already sick. Of course, what we want to achieve is to correct the imbalance, right? So this is crucial in diagnosing and understanding the patient's unique health situation. Okay. In Chinese medicine, recognizing the norm is very, very important. We should know what is normal and what is not. Okay. So differentiating between the normal and the abnormal. Many individuals exhibit signs that are common, like pale tongue with teeth marks, but these do not reflect optimal health. So as long as the tongue is pale, you're not healthy. Okay, recognizing that common signs can mask underlying imbalances is crucial for accurate diagnosis. A thorough understanding of what constitutes a normal physiological state is essential. Peking tongue without markings indicate balance in the body system. And this should be the benchmark against which deviations are measured. So always compare the color of your tongue to the color of fresh meat, okay? Pink. Training and practice are essential to develop observational skills needed to differentiate between the norm and the common signs. Regular assessments and reflection on observed signs enhance diagnostic accuracy and clinical judgment. So, the importance of observational skills, critical for you to effectively diagnose your patient's condition. It includes pulse and tongue assessment. And if I have the chance to really go to Manila, I would be very excited to share with you some techniques on how to feel the pulse. Okay. So I do not believe that it's so difficult to do it. You just have to practice doing it every day on 10 patients or 10 people a day. Okay. Um, Enhances understanding of the patient's condition, and it develops with consistent practice. So no skill is developed if you do not practice. If you just attend lectures only without practicing, it will not give you satisfaction. And this is the foundation for clinical success. Okay? So learning diagnostic techniques. So the foundation of Chinese medical diagnosis, we have 4 diagnostic techniques. We all know that. Observation, palpation, inquiry or asking, and listening. Each of these plays a critical role in gathering a comprehensive patient info. Actually, what to ask the patient is a skill. It doesn't mean that you just have to focus everything on the asking. You need to learn how to integrate all the 4. Okay. Mastering each diagnostic technique is essential. Each technique provides unique insights into the condition, and proficiency enhances the practitioner's ability to interpret symptoms accurately. Continuous practice is important, no? Regularly engaging in these skills with patients not only builds confidence, but also enhances the practitioner's ability to recognize subtle signs and symptoms. Okay, practicing diagnostic skills. Now let's talk about pulse diagnosis. You should learn how to effectively palpate the pulse, identifying qualities like the rate, strength, and rhythm. Observe the tongue, observe the color, the shape, the coating, and the texture. And then you integrate the findings. In fact, you have to do the tongue and pulse together. Okay? Key aspects of studying patterns of imbalances. 20 plus, you need to memorize 20 plus patterns of imbalance. And there are 5 key chi dynamics to understand. And you need to identify the 2 to 3 common symptoms. You don't have to memorize all of the symptoms. You just have to know what are the key symptoms that correlate with each pattern. Experienced practitioners possess a wealth of knowledge gained from years of practice, enabling them to recognize patterns and symptoms with greater speed and accuracy. This heightened ability comes not from only extensive reading and studying, but also exposure, practical exposure to various cases and clinical settings, allowing them to draw connections and discern underlying issues more effectively. Okay? So intuition is a critical skill in clinical practice. You need to have this, no? You need to have good intuition. This will allow us to quickly recognize patterns and make informed decisions. This ability is rooted in a strong theoretical understanding combined with extensive practical experience, enabling the subconscious to efficiently process information and draw conclusions. Okay? Western diagnosis relies on a framework that often categorizes symptoms through a physiological lens, and we focus on specific diseases and their treatments. This can lead to misalignments when applied to Chinese medicine principles, which emphasize a holistic view of the body. In contrast, Chinese medicine diagnosis is rooted in understanding the body's overall harmony and the qi dynamics. It categorizes symptoms based on patterns of imbalance, allowing for a more personalized approach to treatment that considers the individual's unique constitution and condition. Cautions with Western medical diagnosis. Western medical diagnosis may not accurately reflect the individual's condition. We all know that. So this could lead to potential misdiagnosis and inappropriate treatments. Practitioners should be cautious and consider alternative explanations. Subjective interpretations can vary between practitioners, resulting in different diagnoses for the same symptoms. This highlights the need for a thorough understanding of each patient's unique situation. Independent assessment and critical thinking are essential in the diagnostic process. Practitioners should rely on their training and judgment rather than solely on another's diagnosis. Okay, so next, let's translate Western diagnosis to Chinese medicine. We should break down the Western diagnosis into its component symptoms and underlying pathological processes. We should translate the identified symptoms into a Chinese medicine context by correlating them with relevant organ systems and qi dynamics. Determine appropriate treatment methods based on the reconstructed Chinese medicine diagnosis, considering unique patterns of imbalance. Okay, let's have some case examples, no? Case one is irritable bowel syndrome. Okay, the patient presents with abdominal pain, bloating, and irregular bowel movements. So, understanding the condition through TCM reveals potential patterns like spleen Qi deficiency or liver Qi stagnation. So, we might use acupuncture points like spleen 3 and liver 3 to harmonize digestion and to relieve stress. Another case would be anxiety. This is also very common. So, a patient with anxiety will present with racing thoughts, restlessness, and difficulty sleeping. From a TCM perspective, this would be linked to heart yin deficiency or liver qi stagnation. So, treatment, we can use calming points like your favorite heart 7 and liver 2 to support emotional balance and relaxation. Integration of Western and Chinese perspectives allows for a more comprehensive treatment approach. Assessing the patient's symptoms and understanding the underlying patterns provides tailored treatment plans, incorporating both acupuncture and lifestyle adjustments to enhance overall well-being. So, a strong theoretical foundation in Chinese medicine, physiology and pathology is essential for effective diagnosis. If we understand the pathomechanisms behind symptoms and signs, we can identify imbalances and apply appropriate diagnostic techniques. Okay?